So first of all, I would like to thank you for attending the event. And first question would be, what were your key insights from the sessions and events till now, and what do you have to say about whatever the speakers have said till now?
It's early on in the day, and so far it's just the second session continuing. But first off, see, it's a real great initiative from the APAC News Network in organizing this kind of a national level conclave, and it serves as a great platform for exchange of ideas, sharing of best practices, and more importantly, spreading a mindset of technology, opening our eyes to what is possible. Of course, see, there are degrees of smartness, technology adoption, and so on and so forth. But this does brings us kind of up to date on what's going on and where we need to go. So certainly, see, some of the takeaways really is that there is great scope. Many individual hospital representatives have been speaking, and each hospital has had certain specific areas where they have moved forward and made advances. Yes, every hospital has its own circumstances. And of course, seen the inaugural session, it was from more public health perspective kind of a picture. There were representatives from the government of India or public health or government hospitals. The AIMS really Bhopal, and there were representatives from Sweden also. So then that's a different perspective. See, generally healthcare, when we say hospital, but no, hospital is really the last step of it. The ICU is the last stage. Health begins at home. It begins in the womb and continues from vaccination. To see, India used to be 26 years life expectancy when we started off our independent journey, and we are more than 2.5 times of that, and still going. So it started off from public health, nutrition, sanitation, and here we are now trying to move to the next level, and that's the message one would get from there. Of course, see, the as we move forward and forward, the low-hanging fruit is really gone, and then you say the reward for every a penny spent, the return on investment, so to say, gets lesser and lesser. But today's Indian, let us say, is more demanding. He can afford it. Our levels have increased. So expectations have also increased, and people are prepared to pay. So there we are moving in that direction. Again, some of the key concepts that came out were efficiency in operations, one, and two, in actually patient care as such, and three, if you can look at important thing more than the quality or patient satisfaction, the concept brought out strongly was safety. Safety. So many of our healthcare related activities involve some degree of risk to the patient, and where numbers are so large, then even that small 0.01% of risk translates into some absolute numbers which can be really significant. So these are the key concepts where each of the speakers seems to be propounding certain areas where we can progress, where we have progress, and where we need to go.
Also, so as we are on a path towards a Viksit Bharat 2047, as our Prime Minister has also highlighted, what efforts do you see the public and private partners taking, and the hospitals taking, in making in leveraging the digital technologies in public health infrastructure? And is your hospital specifically taking any initiatives regarding the same, leveraging the use of digital technologies and AI in patient healthcare?
Yes, so Viksit Bharat really, on a national level, when we see, we have to see that there's a huge diversity in the kind of, you can say, the extent in which the healthcare needs are. You have very, very underdeveloped areas, and you have super developed areas. Right now, we are standing in Delhi at the Lalit, right in the heart of the national capital. But probably 100, probably, let's say 10 kilometers away, there are areas which are very, very, very underserved. So when Mr. Modi makes this, see, I believe he's talking really of a broad-based upliftment of the healthcare status of the average Indian as such. And see, those things again fundamentally will go down to the rock bottom basics. Where earlier we were focusing on nutrition, infectious diseases, prevention, vaccination, now it's moving towards lifestyle diseases. And there's no end to it. You say cancer, genetic analysis, etc. So we are moving in that direction. And so we have this great diversity. And India has this knack, first level, second level, and then you leapfrog directly from first level to fifth level and so on. So I'm saying, see, it is time being, in my understanding, when Mr. Modi is speaking of it, he's talking of it it, making it very, very, very broad-based. Yes, in the past, maybe couple of decades, rapid strides have happened in improving the average level of healthcare. See, one is availability, access of the care, and two is the continuity of the care and the quality of the care. Yes, so see, Viksit Bharat typically is talking of rock bottom fundamentals. But yes, now there's a technology backbone. If you say COVID hit us 2 years back, 3 years back, it was that COVID app. See, it was a tracking system. See, at that point, it felt like it's a surveillance. Yes, it was a surveillance, but it was with a good intent and for the benefit of the patients themselves. Yes, there may have been data breaches, so on, so. But see, things like that were they leapfrogged us in this technology thing, and from that. The Coven app came. TCS brought out that Coven app. So on a massive scale, the vaccination took huge shape. Of course, it was very short-lived, and yes, it served its purpose in containing the extent of the damage from COVID, and we survived unscathed, as did many other places across the globe. But yes, it demonstrated to us, yes, we have the capability, and this is the way forward. So I think, see, the government has taken out immunization. Yes, so see, this is starting even before the child is born. There's a massive tracking system. Anyone who undergoes an ultrasonogram, it gets reported. So it gets reported and gets tracked. This many months to deliver. Let's say expected date of delivery is December. Which is perhaps 3 months from now. So the person gets tracked. A person from the health department visits that patient and tries to see that their nutrition, their vaccination status, and their follow-up is in line with basic norms, a rock bottom basic norm, which certainly is something. And then they follow up with the child itself. It's a massive database. See, particularly in states which were backward, what we call the so-called in olden days, Bimaru states, Bihar, Maharashtra, Bihar, Madhya Pradesh, Uttar Pradesh, Rajasthan kind of thing, which they have progressed by leaps and bounds. But see, in these states is where I see that such enrollment is very, very high levels, very, very high levels. I believe it has crossed more than 60% of the people who are born today have actually been booked the pregnancy, means tracked properly, nicely, delivered appropriately in a healthcare setup rather than at home left to chance. It starts from right there, and then the immunization. So all these things, see, earlier we would have a card, that immunization card. You tick it, mark it, then they lost the card, gum ho gaya, pata nahi ki hua hai nahi. Now it's online. And the thing is, Aadhaar has made it much easier. See, of course, it has pluses, minuses, safety, security, etc., misuse. But see, so it's a unique person who is availing of these benefits and is getting it. So actually, I think what is happening is that the government is trying to set up a framework within which this will move forward. Compliance definitely is going to be low initially, but with time it will get ramped up. And at some point they'll say, no boss, hona hai to hona hi hai, aur kuch nahi kar sakta. No, you have to accept it. So they are setting up the framework within which, and this is Ayushman Bharat Digital Mission. This is from the this is trying to address the registration of stakeholders. Me being a part of the healthcare provider, this side of the fence, okay, all healthcare providers, hospitals need to get registered, certain basics. And then the doctors get registered, the technicians, the nurses gets registered. That is one side of it. So this ensures that there's certain degree of quality. If you say that somebody who's not a qualified person, not registered at the medical council or nursing council and practicing, then their value comes down. Today when say somebody, okay, I know, let us say this stock market is a huge thing. The broker needs to be registered. Today there's no question of any unregistered broker or middleman. So it's that kind of a thing which is happening on this side of the setup, let's say. And on the other side, the patient registers, and eventually they're looking for a digital kind of a record of their health status, their progress, and which can be accessible by other healthcare providers. Of course, there are checks and balances, and also by the patient. So there's a record. See, today, I don't know what vaccination I got when I was born. It might be there somewhere. It's all gone. But this person going to have it lifelong. Something, there is something of relevance in my background, which I don't know, which may be of significance to me in the future. So that is the step. And then the other thing, really, if you say, what is the concept or use of AI and so on? See, it's the concept of data. Everything is all data. How we leverage the data available with us. First of all, data was not available. Now it is more and more getting available in larger and larger sizes to be able to draw some inferences, to detect some patterns. And of course, yeah, we are very, very at a rudimentary stage. Perhaps 5 years, 10 years from now, you will think, oh, no, that so 5, 10 years back, this was not there at all. So we are in a very rudimentary stage. A lot of data is getting generated, and it is getting in a standardized format, where it is comparable and where you can draw definite conclusions and so on and so forth. There's multiple data. So this is okay, preventive care or actual therapeutics or actual, kind of basic healthcare parameters and so on. So see, a lot of data. So there is the role of AI. Data is the AI guy's wet dream, really. He has the data. You can do major things with it. Never imagined. Not possible. Just inside now, the gentleman from Max was saying that when he wanted some data 10 years ago for a National Board of Exams inspection, somebody had gone and got it from somewhere. Then he found discrepancy. It took 3 hours to get. But see, today he has it at his fingertips, and that is just at one hospital level. This we are talking of is not even a chain of hospitals, not even a set of things in a city. It's across the nationwide data. So that's how AI works generally. They look at patterns and they draw conclusions, and you might get millions of pieces of interpretations, but you'll find 1, 2, 3, 4 key things. That small 10% intervention is going to have 90% impact. So this is very, very generic and general, ma'am. I don't know how specifically we can look at it, but this is a concept as I understand it for today. Yes, ma'am.
Thank you so much, sir. Thank you for interesting insights. Thank you. Yeah, definitely. Thank you so much.